We're first going to talk about elderly and geriatric population. The elderly population faces unique mental health challenges due to factors such as aging, social isolation, physical health issues, which underscore the importance of mental health promotion for overall well-being. Common mental health disorders among older adults include depression, anxiety, cognitive decline, and substance abuse disorders. And risk factors include chronic illnesses, bereavement, loneliness, and socioeconomic factors. These mental health issues contribute to healthcare cost, caregiver burden, and reduced quality of life. The prevalence and structure of mental health disorders in older people vary significantly, with depression and anxiety disorders being the prevalent components. Depression in particular affects a significant portion of the elderly population, with varying prevalence rates across different countries and regions. Cognitive impairments are also common among older adults, often coexisting with mental health disorders, exacerbating their prognosis. Understanding the structure and prevalence of mental health disorders among the elderly is crucial for optimizing the functioning of healthcare systems and providing effective care for this population. The diagnosis and criteria for this population is widely utilized is a the DSM-5 is a widely utilized tool for diagnosing various mental health conditions. It provides specific criteria for each disorder, ensuring standardized assessments across healthcare settings. Examples of disorders covered include major depressive disorder, generalized anxiety disorder, and neurocognitive disorders. To aid in accurate diagnosis, assessment tools such as the Geriatric Depression Scale (GDS), Mini Mental State Examination (MMSE), and Geriatric Anxiety Inventory (GAI) are employed. These tools help clinicians systematically evaluate and measure symptoms, contributing to a comprehensive understanding of the individual's mental health status. The DSM-5, with its detailed criteria and assessment tools, plays a crucial role in guiding healthcare professionals toward accurate and consistent diagnosis in the field of mental health. The treatment plan for this population would be a variety of modalities to address their mental health needs comprehensively. Pharmacology involves the use of SSRIs like sertraline for depression, with caution regarding the potential side effects of anxiolytics. Donezepam is another medication employed for cognitive design. Collaborative interventions engage a multidisciplinary team, including geriatricians, psychiatrists, nurses, and social workers. Psychotherapeutic options like CBD therapy and reminiscent therapy are utilized. Patient education focused on coping strategies, adherence, and self-care. Specialized referrals such as geriatric psychiatry are considered. The approach is evidence-based, relying on data from clinical trials and guidelines, ensuring the treatment is tailored to the unique needs of the elderly population. The next population I'm going to talk about is perinatal mental health. This covers pregnancy and postpartum, and it's pivotal for maternal and child well-being. It addresses conditions like postpartum depression, anxiety, and obsessive compulsive disorder. The prevalence of perinatal mood and anxiety disorders affects 10 to 20% of women, influenced by hormonal changes, mental health history, and a lack of support. These conditions impact maternal-infant bonding, leading to increased healthcare utilization and potential long-term consequences. To address this, specific diagnostic criteria DSM-5 for perinatal disorders such as postpartum depression, anxiety, and depression guide assessment tools like the Edinburgh Postnatal Depression Scale and Generalized Anxiety Disorder. The diagnosis and criteria for this population. The perinatal mood and anxiety disorders are diagnosed using specific criteria outlined in the DSM-5. Examples include postpartum depression, postpartum anxiety, and postpartum obsessive compulsive disorder. Assessment tools like the Edinburgh Postnatal Depression Scale, Patient Health Questionnaire 9, and Generalized Anxiety Disorder 7 aid in the diagnostic process. The systematic review by Butler 2020 highlights the negative association between perinatal depressive symptoms and breastfeeding behaviors. However, data and data heterogeneity and lack of consistent operational pose challenges emphasizes the need for standardized measures globally. The treatment plan would include pharmacotherapy for perinatal mental health, involving using a cautious use of antidepressants, particularly SSRIs, closely monitored during pregnancy and lactation. Collaborative interventions with obstetricians, psychiatrists, and lactation consultants are essential. Therapeutic interventions, including cognitive behavioral therapy and interpersonal therapy, contribute to a holistic care. As an evidence-based approach, staying informed about perinatal mental health research and tailoring interventions to individual needs ensure effective and personalized treatment for this vulnerable population. The next population would include pediatric and adolescents. The pediatric and adolescent population, spanning from ages 0 to 18, encounters distinctive challenges associated with the growth, development, and socialization. Prevalent mental health disorders encompassing anxiety, depression, ADHD, and conduct disorders manifest within this age cohort. Influencing factors: compromised genetics, family environment, trauma, and adverse childhood experiences. These conditions not only affect well-being, the individual's well-being, but also incur economic cost by disrupting academic performance, altering family dynamics, and compromising overall societal health. Recognizing significance of early intervention, addressing mental health concerns in youth becomes paramount. By understanding and addressing risk factors, promoting resilience, and fostering a supportive environment, efforts can be directed towards mitigating the impact of mental health disorders and facilitating the healthy development of the patient and adolescent population. The diagnosis and criteria for this population. The DSM-5 serves as a crucial tool offering standardized criteria for diagnosing mental health conditions among children and adolescents. Within the population, specific disorders such as major depressive disorder, generalized anxiety disorder are identified by persistent symptoms like sadness, loss of interest, excessive worry, and restlessness. These criteria provide a comprehensive framework for clinicians to accurately diagnose mental health challenges in young individuals. An accurate diagnosis becomes the cornerstone for effective treatment planning, guiding healthcare professionals toward interventions that are precisely tailored to address the unique needs and symptoms of each child or adolescent. This emphasis is a pivotal role of early identification and intervention in pediatric mental health care, aiming to alleviate the symptoms, enhance overall well-being, and promote healthy development in the young population. The treatment plan for this population involves a multifaceted approach. Pharmacological interventions such as stimulants for managing ADHD are employed. Collaborative interventions including an individual education plans, IEP, for academic accommodations and family therapy to enhance communication and contribute to a holistic care. Psychotherapeutic options like CPT prove effective for managing anxiety and depression, teaching valuable coping skills and cognitive restructuring. Referrals to child psychiatrists or specialists, coupled with providing families with resources of psychoeducation enhance the overall treatment strategy for pediatric mental health. The challenges in providing mental health care for children and adolescents in sub Sahara Africa further highlights the need for global efforts to address this critical issue. The next, the next community would be the LGBTQ community, representing diverse sexual orientations and gender identities, encounters elevated mental health risk, including increased prevalence of conditions, substance use, and suicide. Fear-driven avoidance of medical care exacerbates these challenges, contributing to economic cost due to discrimination-related stress affecting work productivity. Addressing mental health within this community becomes imperative not only for the individual well-being, but also for the mitigating broader healthcare expenses. In the realm of primary care, understanding and addressing the unique mental health needs of LGBTQ individuals is vital for fostering a supportive healthcare environment and improving overall outcomes. Cultivating inclusivity, awareness, and specialized care protocols can significantly contribute to promoting mental well-being within this diverse population. The diagnosis and criteria includes compromises individuals with diverse sexual orientations and gender identities. The DSM-5 again outlines specific criteria for diagnosing mental health conditions in the LGBTQ individuals. Gender dysphoria, characterized by distress due to incongruence between gender identity and assigned sex. The major depressive disorders are common, with a higher prevalence of anxiety disorders linked to coping mechanism. Elevated risk of suicidal ideations and post-traumatic stress disorder further underline the necessity for accurate diagnosis. The treatment plan involves a comprehensive range of interventions tailored to address diverse needs. Pharmacologically, SSRIs are utilized for depression, while hormone therapy plays a crucial role in gender affirmation. Collaborative interventions extend to counseling, involving support for individuals, groups, and families. Psychotherapeutic options include mindful-based stress reduction techniques and trauma-focused therapy specifically designed for addressing PTSD. An essential aspect of treatment planning involves thorough discussions about medication involving benefits, risks, and potential side effects. Moreover, facilitating connections with LGBTQ friendly resources through referrals ensures individuals receive holistic and supportive care, fostering a more inclusive and affirming approach to mental health treatment within the LGBTQ community. Next is immigrant workers. Immigrant and migrant workers encounter distinctive mental health hurdles stemming from factors like cultural adaptation, language barriers, and social isolation, often leaving them behind familiar environments and supportive networks. This leads to increased risk of anxiety, depression, and PTSD, compounded by discrimination, precarious work conditions, and limited healthcare access. The diagnostic criteria offers often faces migrant and immigrant workers often face unique mental health challenges um, like depression, general anxiety disorder, and adjustment disorders. Understanding the cultural variations in symptom presentation is crucial, requiring healthcare providers to maintain cultural competence during assessments. It's essential to recognize that cultural norms impact how mental health symptoms are perceived and expressed. Providers should avoid biases with stereotypes, ensure accurate communication, and potentially collaborate with interpreters. The treatment plan would include collaborative interventions with social workers, community organizations, and language interpreters. Psychotherapeutic options like group therapy foster social support and reduce isolation, while participation in culturally sensitive support groups is encouraged. Pharmacological interventions would include selective serotonin reuptake inhibitors, addressing depression and anxiety, with closely monitoring dynamics, kinetics, and contraindications and side effects. Next, we have ethnic minority groups. They often have mental health disparities and are influenced by factors such as cultural stigma, language barriers, discrimination, socioeconomic challenges, leading to increased rate of depression and anxiety within these communities. Within racial ethnic minority groups, individuals are less likely to initiate mental health services and use and are more likely to drop out prematurely. Cultural competent treatment regimens can mitigate racial biases, enhance treatment seeking, and improve outcomes. Diagnosis and criteria. Cultural considerations play a significant role in understanding symptom expression and help seeking behavior. Clinicians must be aware of cultural idioms of distress and accurately assess and diagnose mental health conditions. However, diagnostic challenges such as overdiagnosis or underdiagnosis may arise due to cultural differences. Collaborative assessment approaches, including the use of cultural formation, interview, and involvement in interpreters if needed, are essential to ensure culturally sensitive and accurate diagnosis. The treatment plan would include psychotherapeutic options, cognitive behavioral therapy, cultural modifications, and narrative therapy that respects cultural narratives. In summary, the treatment plan emphasizes a comprehensive approach that combines pharmacological interventions and psychotherapeutic options, ensuring culturally competent care in collaboration with primary care providers to provide holistic support. And these are the references.